Okay, folks, good afternoon. At a point in everyone's life, there comes an instance in time where there is a sadness that words cannot capture on their own. A sorrow so deep that it cannot be measured. A heartbreak where tears just won't come. And it is at that point today that I have to announce that 8 more local people sadly lost their lives yesterday due to COVID-19. That's 8 more families plunged into grief, and 8 more citizens of this country that have lost their lives with a virus and illness that only months ago would have been wholly unimaginable. The overall number of COVID-19 related deaths recorded by our local health and social care trusts has now risen to 250. This is a significant increase, which includes the 8 deaths which occurred yesterday, but also a number of deaths in recent days that have now been added to the official record. I appreciate that this latest overall total will cause some alarm. These daily figures are compiled for surveillance purposes to help us track the virus and keep the public as informed as is possible. But it's always important to remember that each of these numbers is an individual, a family bereaved, and a life lost. It will only be 8 weeks tomorrow that Northern Ireland first recorded its first positive COVID-19 case. I was speaking at a Home Office drugs event in Glasgow that morning, and I vividly remember being informed of the first case and returning to Belfast. It was a day that I'll never forget, just as there have been days and moments since that many people listening will never forget. We have never walked these paths before, and sadly, there will be more deaths in the days and weeks ahead. Tackling COVID-19 was never going to be easy. There never was going to be a quick fix. But cautiously, I do believe we are beginning to see an improvement. So whilst our priority must remain on helping those who are sick now, as well as supporting the staff that are so heroically looking after them, we must also look to how we will respond to the virus in the days and weeks ahead. And that will include a rigorous programme of testing, tracing and tracking. And that is why today I'm announcing a further expansion of our testing to now include additional frontline workers and symptomatic members of their households. Importantly, this now includes frontline workers in the private sector, with a focus of staff delivering key medical, energy, utility, transport and food supplies. Supermarkets, the telecom industry and Royal Mail have been contacted directly. Employees who think they are eligible and need to be tested are being instructed to speak to their employer, as is when they need a test. The details of how to be tested will be widely circulated across local industry. This latest expansion in testing will allow even more vital workers to return to the front line. In recent days, I have also taken the decision to extend testing to all symptomatic residents in a care home and a potential incident outbreak, as well as for patients being discharged from hospital to a home. This change in policy has been communicated to the service via RTIA and PHA teams. And I've also included and asked for an additional wider testing to ensure and support optimum care for residents and support staff in our care homes. There'll be testing and surveillance in general practice and testing and surveillance in emergency departments. Because only when we begin to understand the next steps of this virus will we be able to find our next path through it. I'll now hand over to the Chief Medical Officer, Dr. Michael McBride.
Minister, thank you very much. Thank you for the opportunity to again address you this afternoon. It seems almost unbelievable that it was a few short weeks ago, as the Minister has indicated, that we in Northern Ireland had our first confirmed case of COVID-19. Since that time, the weeks intervening, this illness, this virus, has transformed all of our lives. It has transformed what we understood to be normal life in Northern Ireland. And sadly, as the Minister has indicated, it has also shortened the lives of too many people in Northern Ireland. It is also with great tragedy that I too acknowledge the additional deaths that have occurred. Whilst we have saved lives and the efforts that you have taken, the steps that we have put in place and the Executive has agreed has saved lives and has ensured our health service has been able to cope with the demand. And yes, the number of deaths are less than we anticipated. Any death is a death too many. And as I've said a number of weeks back, it will only be when we see from a distance, many months and years hence, that we will be able to estimate the true impact of COVID-19 on us as a society. The true numbers of individuals who have died directly as a consequence of COVID-19, where a test has confirmed its presence. Those individuals who perhaps have had their lives shortened, possibly as a consequence of COVID-19. And it will be when we have the data in the fullness of time from the Northern Ireland Statistical and Research Agency, which will look at all-cause mortality and excess deaths as compared to this period of time compared with previous years, that we will have a true reflection of the true impact of COVID-19. For the purposes of our monitoring and tracking the spread and impact of the virus, as the Minister has indicated, we have seen that our actions, the decisions that have been taken, the adherence by you to those steps has indeed saved lives. We have seen a flattening of the curve. We have seen the number of admissions stabilise and begin to decline, both to our hospitals, and we've also seen gratefully, the number of admissions to intensive care again stabilise, flatten, and begin to dip. That is good news. As I've always said, there will always have been information available in relation to deaths, which, because of the reporting of deaths and the recording of deaths, will emerge in due course. But as I say, every life that is lost matters, and every death counts. I just wanted to echo some of the Minister's comments around testing. As we said earlier in the week, we have significantly ramped up our testing capacity as we begin to think of our response as to how this virus evolves in the weeks and months ahead and how our response might need to change. It is vitally important that we have enhanced surveillance in the community. The Minister has already directed the development of GP practice surveillance, as I mentioned, in relation to we do each winter with seasonal flu. We are also looking and engaging with our colleagues in the Health and Social Care Board and primary care colleagues in relation to the feasibility for COVID-19 centres to also add information to that surveillance, but recognising those are first and foremost centres for providing assessment and treatment and care to individuals who are symptomatic. We have embarked on a very ambitious programme in addition to the symptomatic testing of residents and staff in care homes, of testing all individuals in care homes, and a rolling programme to inform the evidence of what surveillance programmes we wish to place into the care sector in the longer term. And as from this week into next week, we will also be extending that surveillance into our emergency departments. It is vitally important that we have more intelligence and data about how this virus is behaving, so that can inform our next response. I can also say that I have been in regular contact, and indeed was in a conference call with my colleagues in the Republic of Ireland today, and the Chief Medical Officer and his team there, in relation to mapping our way forward in the next phase of our response. But as I say, it's too early, as the Minister said, for us to drop our guard at this point in time. We need to continue to do what we're doing. We need to continue to protect ourselves, to protect our families, to protect each other, and to continue to ensure that our health service is there to treat people who need it with the optimal care that they require. And again, just to finally echo Minister's comments from yesterday, and comments which thankfully to you carried for us yesterday and in previous days, it is vitally important that people who experience a sudden deterioration in an already underlying health condition or develop a new worrying symptom, individuals who are concerned about their child, trust your instinct as a parent, and if you would normally have sought advice, seek advice. Do not delay because you're concerned about going out of a house to seek advice. Don't be concerned because you're worried about burdening the health service. We will want to see you, we need to see you if you have a healthcare need, and then we can respond appropriately. And as we've said many, many times, the health service may look and feel different, and those individuals that you see might be behind a mask, and their hand might be in a glove, but they are the same individuals that have been there over many, many years, and their first and overriding concern is your safety, is your care, and just to again commend everyone, irrespective of where they're working in the health and social care system, irrespective of whether they're supplying our PPE to our trusts, whether they're supplying food and support, whether it's all the other public services that have had to work very differently to meet our needs as a society at this time. I want to say a huge thank you to each and every one of them. Thank you.
Good afternoon, gentlemen. Tracy McGee from UTV. These figures show that 34 more people died as a result of COVID-19. Now, you're saying that 8 of those people died in the last 24 hours, but that still leaves 26 deaths that have not been previously recorded. My question is, why is this happening? Because you're talking about the importance of these figures for public confidence and for tracking the whereabouts of this virus. Surely being able to stay on top of the number of people who are dying from this virus is a basic requirement.
And Tracy, we've always been clear in that piece of work that we report the figures of the deaths that have been coordinated through the Public Health Agency. And if you do recall, NISRA is now producing a weekly update of all death certificates and all deaths recorded that include COVID-19, but of individuals who may pass away with COVID-19 but not of COVID-19. I became concerned about a low report that we had on Sunday, where we only actually recorded 1 death, and I asked for a third piece of work to be done. Now, what that piece of work has been done is indicated a number of deaths due to COVID-19, but also with COVID-19, and I asked that figure to be brought forward today. Now, when the NISRA figures do present for the period of time in the next week to 2 weeks, it will capture a number of those deaths that we're recording today, rather than seeing a significant increase in the differential between what we're reporting and what NISRA is reporting. So it's not that these deaths were never going to be reported, it's more in the timeline of the report.
And that had you not initiated this on Sunday after noticing that the death rate was so low that we may not have arrived at this new figure today, that you had to put in place some kind of mechanism to study this, to find out what exactly went wrong? Because surely public confidence out there will be looking at this now and saying, how can we have faith in any future figure we're getting if 26 deaths can all of a sudden go unaccounted for?
They were never going to go unaccounted for, Enda. And I want to dispel that. I want to dispel that perception out there, because people have to have faith in the health service at this minute in time, and the work we're doing to tackle COVID-19, but also, as Dr. McBride said, about asking people to come forward and present themselves to the health service in the report. These numbers, these deaths, now let's remember they are individuals. It's not the fact that they were never going to be reported, it's the timeliness of the report. And there always is a delay in the reporting of a death to the reporting of a death certificate to the presentation of the actual number. But we brought that figure forward, and I thought it was right to bring that forward and put that number in the public domain today, so that people can have confidence in the reporting that we're doing. I wasn't meant to be doing this conference today, nor was Dr. McBride, but we thought the right thing to do was, for me as Health Minister, to bring forward this information as soon as I had it, so that so that the general public can have confidence that we have the measures in place and are reporting the deaths that are there. But let's always remember, these are individuals and these are families. Michael
Yeah,
Jones.
just to add to that, I mean, I think it was Tracy's colleague Ken Reid asked me this question again at this very media briefing, I think 2 weeks ago, if not 3 weeks ago, and I made very clear and outlined the reason why what we're monitoring in terms of deaths to track the epidemic are not a full reflection of the deaths that occur as a result of COVID-19. The process of recording deaths, the process of a doctor recording on a medical certificate of cause of death, and again, the process of capturing the location of those deaths, there is always built-in delays in that. So what we can only produce, and it's important that we're able to track the number of deaths that are occurring in hospital, because that gives us an early indication of how the pandemic is spreading. And yes, a delayed impression of how effective or otherwise the steps that we are putting in place are having. So the deaths that occur reflect disease activity, illness that has occurred a number of weeks back. There is always perhaps a 2 to 3 week time lag between putting in place steps and then seeing a decline in deaths. And as I've said repeatedly and indeed clarified in a number of media interviews, there is and will be excess deaths that will not be reflected in the data that we report in terms of hospital deaths and deaths that have occurred where COVID-19 has been reported in the last 28 days. It will only ever be some weeks from now when we get the quarterly NISRA reports in terms of looking at excess all-cause mortality, or indeed further reports further into the future when we will actually be able to see the true impact of this virus in terms of mortality, both in those people who've died directly as a consequence of COVID-19, where that's been confirmed, those where it's been suspected but not confirmed, because again that will be captured on their medical certificate of cause of death by their general practitioner and the doctor registering the death, and then people who may have died of other conditions, perhaps as a consequence of the fact of the extraordinary steps that we have now taken to protect the public and to save lives. So this story will need to be told at some time in the future, but it is vitally important for the reasons you have mentioned, that we get as much information into the public domain as early as we possibly can. And if there's a need to update that information, it's crucially important that we do so.
Afternoon, gentlemen. David Young here from PA Media. I just wanted to have a question about restrictions, if you don't mind, and certainly the north-south relationship and the north-south dimension. You mentioned discussions with the CMO in the Irish Republic. Is an all-Ireland approach to coming out of these restrictions, changing the restrictions anyway, being discussed? Is that something of the executive's planning? Is it required in order not to undermine steps that are being potentially taken each side of the land border? Setting politics aside, in terms of one unit in a healthcare sense, is it required? Is there some sort of link up required that we sort of do this thing in step with each other coming out of this restrictions? And just secondly, could I ask maybe both of you as well? We know there's been this issue over recent days in terms of cemeteries and cemetery visits. Could I get your own views in regard to that issue, and maybe especially from the Chief Medical Officer, why would those not be allowed, considering so many other things are allowed in regard if social distancing does take place?
David, in regards to the steps that Northern Ireland will take to come out of the restrictions that are put in place by the regulations passed by this place, that will be a decision for the Northern Ireland Executive to take. And I suppose taking cognizance of what has happened in the rest of the United Kingdom and also in the Republic of Ireland, but crucially, based on the scientific fact and medical evidence of where we are at any particular time in regards to COVID-19 and how that virus is either present or spreading within our population. So it's important that we take our scientific guidance based on the science that is applicable to Northern Ireland, and that's where the executive is, and that's why at our executive meetings I give a daily update, and I think the Chief Medical Officer and the Chief Scientific Advisor will be briefing the executive this Friday. But let's always remember, in regards to some of the restrictions and regulations that were brought in places we were actually ahead of the Republic of Ireland. That we closed our pubs, we closed our restaurants, actually before the Republic of Ireland did. So while working together is important, we should always be cognizant of where we are in regards to the virus. In regards to cemeteries, as Health Minister, I would see no reason why people couldn't be visiting cemeteries at this minute in time. There is a solace, a support there that many individuals can gain from visiting a cemetery, and it's something when we reflect on where we have been and where we are now. It's a regulation that I think we as an executive should actually challenge and change, because we have to realise that the mental challenge that we're putting on many individuals by asking them to remain in lockdown. Some will receive solace and support by visiting the graves of loved ones, and it's something that I hope the executive can come to a reasonable position on, where we can open up cemeteries in a managed way. Should it be in a one direction approach around the cemeteries in a single file, or the number of people entering cemeteries, or the actual time of day that cemeteries are open? But I think it's an approach that we as an executive should be looking to.
Just if I may, Minister, obviously my role is to provide advice to ministers and the executive, and that's what myself and the Chief Scientific Advisor will continue to do, and the decisions are ultimately matters for Minister. I have to reinforce the Minister's point, not on this specific issue, but more generally, that we all need to be acutely aware of the psychological consequences of the measures that we have currently put in place on our own mental health and well-being, our own emotional resilience. And we are, as a health system, concerned about that and doing many things to support individuals, particularly those individuals who are shielding for now some many weeks. And the impact that it's having on all of us, that human interaction, that sense of community that's so important to us in Northern Ireland. And we talk about social distancing. And in some respects, we've never been more connected as a community and as a society, even though we're at distance from each other. I would also say, in terms of your first question, that we have long held very productive professional working relationships with colleagues in public health and government in Scotland, in Wales, in England, and in the Republic of Ireland. And it is absolutely crucial that we play to all of the strengths, as Minister said, the scientific evidence, the modelling, as we begin to consider providing our best advice to ministers as to how and when it is appropriate for us to begin to think stepping back from some of those interventions, in what sequence and in what order. But again, that can only be guided by a decision as to when it may be the right time to even think about doing that, and based on the science and based on the evidence. There is no doubt that we share a common landmass with our close colleagues and neighbours in the Republic of Ireland, and that is something that we will closely need to consider. And I think the other thing which I would point out is that the virus on this island, in the Republic of Ireland and Northern Ireland, is behaving very similarly and different to other parts of the United Kingdom. And you heard Professor Young, Chief Scientific Advisor, advising on some of the reasons why that might be the case, partly as a consequence of our introduction of those measures earlier in the spread of the pandemic into Northern Ireland and the Republic of Ireland, but also because some of the aspects of our population density in the Republic and in Northern Ireland. So I can assure you that we will be and are working very closely together and will be providing our best advice to ministers and to the executive for the executive to make decisions on those issues.
Hi, Alison Morris from the Irish News. Minister Swann, can you tell me what is being done by the department in relation to the staff shortages in care homes? And we know that those facilities rely quite heavily on agency staff, and it's been reported today that some agency staff are refusing to work in homes where COVID has been detected. So what is your department doing in relation to that? And also, we know that now all patients being moved from hospital to care homes are being automatically tested. Will that testing also apply to people who are being moved into a care home from their own home into a facility automatically, rather than only if they're symptomatic?
Alison, in regards to your first question and what support mechanisms were given to care homes, both the private and the independent sector on our own, we've actually been working intensively with the unions. I'm aware that has been made public, but we are so where our own trust staff can actually go and work in care homes, both in the private and the independent sector, to make sure that there is a support there for the staff who are working in their homes, but more crucially for the residents of those homes there as well, so that they can get the support and succour that they need through this very challenging time. While we are asking them to social distance, while there's a restriction on the number of family visits. So that is work that I'm actually glad to say that has been progressed quite swiftly, working with partnership with the unions and with our trust staff as well, so that we can provide that support to the independent sector. At this minute in time, we have made no provision for testing somebody coming from their own home, into a care home. But our recommendation always is that a new resident coming from that scenario should be self-isolating for a period of 7 to 14 days, 7 days, depending on what their scenario is. But if they are coming in, or there is a concern that they do become symptomatic, testing will be provided, because as we indicated here on Monday when we last done this press conference, that the testing to care homes has been expanded, and it's a key area that I have asked the department and PHA to follow up on. Michael,
yeah, just thank you, Alison. I mean, it's a hugely important area, and I know a matter of significant public concern. We know that individuals in nursing homes and residential homes represent some of the most vulnerable people in society. I want to take this opportunity to commend staff working in that sector in very challenging circumstances, the efforts that they are going to, the new arrangements that they have proposed, working with the department in terms of ensuring that we protect the most vulnerable in our society. In Northern Ireland, I think we have benefited from an integrated health and social care sector. For many, many weeks now, we had the Minister made the decision to repurpose the work of the Regulation and Quality Improvement Authority to support the care sector and staff working in that environment, and to identify contact points, individuals for contact within our trusts, so that our trusts could work with RQIA in support of the sector. That has worked extremely well. As Minister has also indicated, we're acutely aware that the last thing anyone working in the sector wants to do is to put anyone at risk, because after all, these are people's homes. They may not be living in their own home, but these are their homes. There is long-established relationships between those working in those facilities and the individual patients and our residents and their families, and we are doing all that we can to support those individuals in terms of providing the care, guidance, in terms of whether that's in relation to PPE, enhanced training around infection and prevention, control, around cleaning and enhanced models of cleaning. We have a long-standing relationship between the Public Health Agency and their health protection team, which advises the care home sector when there are outbreaks of infectious diseases, whether that's norovirus or flu. So there are well-established, tried and tested means of supporting the sector. Now, those have been enhanced because we're dealing with a much more transmissible virus than seasonal flu. And there are mechanisms in place for individual care homes to check in on a regular basis, whether online or by telephone call, to get advice as to the situation within the sector. The final thing I would say is that there are also trust staff and volunteers working to support the sector at this time, because we appreciate that there will be staff shortages, and we need to make sure that there are mechanisms in place to ensure that those facilities can continue to provide the care that's required. But again, this is a new virus. You know, we still have much to understand about the virus, and it's crucially important that we understand the most effective means of testing for the virus, whether that's in our facilities or whether it's staff, Because don't forget, and I don't want to complicate this further, but a positive test for COVID-19, for SARS-CoV, could mean that someone has had the illness some time ago and still has RNA evidence of the virus, but may themselves no longer be infectious. So, this is not straightforward, and we are developing the science, developing our understanding, because the Minister has said we absolutely need to be guided by the science and guided by the evidence in terms of how we keep individual residents in these facilities safe and how we keep staff in these facilities safe as well.
Okay, thank you.